Hello guys, today we are talking about the hypertension. In the previous lecture, we discussed how the physiologically blood pressure is regulated and maintained at a set point. Today we are defining the hypertension, how the hypertension is defined and diagnosed, then what's the pathophysiology of the hypertension, its classification according to the etiology or according to the clinical feature, and then we will discuss the hypertension complications and pathogenesis. Okay, hypertension is defined as abnormally sustained elevated arterial blood pressure. So when we talk about the hypertension, we mean systemic arterial blood pressure, not the pulmonary circulation. As you know, the hypertension may occur in the arterial side, systemic arterial side, or in the pulmonary arteries. Also, we have portal hypertension, portal vein hypertension. But when we say hypertension without any further specification, we mean the elevated arterial blood pressure in the systemic arteries. So the hypertension is defined as abnormally sustained elevated arterial blood pressure. So what's the abnormal elevation of the hypertension and what's normal physiological value for the blood pressure? You may say the blood pressure normally should be equal to 120 over 80 millimeters of mercury. Generally speaking, the normal blood pressure is regarded as 120 systolic value of 120 millimeters of mercury, and the diastolic value should be 80 millimeters of mercury. But that's not true for all patients or all persons. This is average blood pressure in a specific population. But some people, for example, someone have a blood pressure of 121 over 81. Should be considered abnormal or hypertensive? Or someone may have a blood pressure of 190 over 79. Should this person considered as hypertensive and diagnosed with hypertension either when it's 1 millimeters of mercury higher than the 120 over 80 or 1 millimeters of mercury lower should be said to be hypotensive? No. The blood pressure depends on many factors. We have many physiological variations for the blood pressure. For example, height. The first important physiological variation to the blood pressure is what? Is height. And taller people usually have a higher blood pressure and shorter people have somewhat lower blood pressure. And then we have what? Weight. The person's weight. Even if not obese, those in a specific population with the same height and other factors to be constant, those have more weight, usually have a higher blood pressure, and those with less weight have lower blood pressure. Then we have color. For example, black people have a slightly higher systolic blood pressure than white people. So you can say race and ethnicity. Okay. Another factor, another physiological variation for the blood pressure is age. By the age of, in newborns, it's about, the systolic blood pressure is about, okay, in newborn, it's equal to what? 40 millimeters of mercury. At 1 month, it will reach, at 1 month, the systolic blood pressure will reach about 80 millimeters of mercury. Then, by the age of 17, the adult blood pressure will be reached, which is about 120 over 80. at 70 years old, usually it is 120/80. In elderly, even elderly, when they are not considered to be hypertensive, normal all persons, for example, someone at the age of 70 to 80 years old, it's usually about 150/90. So these are some physiological variations for what? For the blood pressure. You see, with age, the normal blood pressure will be increased. Then another physiological variation for the blood pressure is what? Is sex. Females before the menopause, have a lower blood pressure when compared to the males with corresponding height, weight, ethnic group, or age. But after the menopause, usually females have a higher systolic blood pressure than the males. Okay, these five: height, weight, and race and ethnicity, age, with sex, are 5 important physiological variations that determine the average blood pressure in a specific population. So generally, the normal blood pressure for the systolic value, systolic blood pressure, somewhat between 1.5 to 135 plus millimeters of mercury. And the diastolic blood pressure is somewhat between 60 to 85. So anyone have a slightly higher blood pressure, more than 120/80, should not be considered as hypertensive. We have so many physiological variations that determine the average blood pressure in a population. But for the medical purposes, generally speaking, 120/80 is regarded as a normal blood pressure for clinical evaluation. When someone have a 120/80 is regarded as normal, or even below than this value, is regarded as normotensive, but 120/80 requires medical attention. Okay, so this is the simple definition of the normal blood pressure in any population, which is determined by these physiological factors. Now, the hypertension usually defined as a systolic value when it's more or equal to 140 millimeters of mercury. And the diastolic blood pressure usually when it's more or equal to 90 millimeters of mercury. This value are determined as a cutoff for the diagnosis of the hypertension. When the systolic value is equal to 140, or when it's greater than 140, and also when the diastolic blood pressure is equal to or more than 90 millimeters of mercury. If someone has only the systolic elevation of the blood pressure, it's regarded as hypertension, even when the diastolic blood pressure is lower than 90. And these patients are said to have isolated systolic hypertension. And when the systolic blood pressure is lower than 140, but the diastolic blood pressure is more than 90, this patient is again regarded as hypertensive, and they are said to have isolated diastolic hypertension. Isolated diastolic hypertension is somewhat more common in young adults. Okay, while this is maybe seen isolated diastolic blood pressure or isolated hypertension, sorry. But systolic hypertension, along without elevation of the diastolic blood pressure, usually seen in elderly. Okay. However, most hypertensive patients have elevated systolic value and diastolic value both. Okay. Physiology or pathologically, maybe one of them developed first, but then the other one will be developed. How? Let's suppose here we have a simple diagram of the heart. This is the left atrium and this is the left ventricle. This is the aorta. Okay. Here we have arterioles. Okay. And these arterioles are resistance vessels. Let's suppose someone, and this is the aortic valve. Okay. Let's suppose someone having high blood volume. Okay. When the blood volume is more, as we explained in the physiology of the blood pressure regulation, when the blood volume is more, cardiac output will be more, and the systolic blood pressure will be more. If someone first developed systolic hypertension, it means cardiac output is more. This high systolic blood pressure will reach the resistant vessels. These vessels, these arterioles, which are regarded as the resistance vessels to the blood flow, will be constricted. Okay, why they are constricted? For the purpose of protection of the tissue from high blood pressure, high systolic pressure, and from hyperperfusion. These arterioles in any organ have an intrinsic ability to regulate the blood flow and thus the blood pressure to that organ. For example, when the blood pressure is high, these arterioles will constrict. They will be resistant to the blood flow from the arterial side to the venous side, and this protected the tissue in this organ from the bad effects of this high blood pressure. And when the blood pressure is low, they will dilate, so the blood flow to this organ will be more, and this organ or this tissue is supplied with sufficient blood. Let's suppose we have a patient with increased blood volume. Okay, when the blood volume is more, it means what? Cardiac output is more, systolic blood pressure is more, and these arterioles will constrict. But with time, with years, this arteriole will be continuously constricted, and they said to have what? Diastolic hypertension. So the diastolic hypertension was developed in response to the systolic hypertension. The smooth muscle in the arterioles undergo reactive hyperplasia and hypertrophy. This is called what? Reactive what? Hyperplasia. Reactive hypertrophy. And of course, development of or increasing the connective tissue in the arterioles. Increase what? Connective tissue. And due to this reactive reaction of the hyperplasia, hypertrophy, and increasing the extracellular matrix and the connective tissue, even these vessels with years, they will be even more resistant to the blood flow, and the diastolic blood pressure will be increased more because blood is trapped in the arterial side and cannot easily pass to the venous side in response of the vasoconstriction or the resistance by these arterioles. And the reverse is also true. When someone has, for any reason, chronically resistant arterioles, these arterioles, tonically constricted, then the heart should pump against more resistance in the arterial side, so the cardiac output is increased, and with time, this patient is starting with the diastolic hypertension, again develop what? Systolic hypertension. So what I want to say is the systolic blood pressure and the diastolic blood pressure are very closely linked to each other. Whenever someone develops systolic hypertension, with the risk, the diastolic hypertension will be also developed, and the patient will have both systolic hypertension and diastolic hypertension. And again, when someone first develops diastolic hypertension, this type of diastolic hypertension for the heart should be pumping more forcefully to able to pump the blood into the aorta and the arterial side. Then the patient will also develop what? Systolic hypertension. Okay? The real question is that why this value is regarded as hypertension? Why for the systolic 140 and for the diastolic 90 millimeters of mercury or more than this value is regarded as hypertension, and any patient that have this value will be diagnosed with hypertension. Of course, we cannot trust only one or decide on the basis of only one measurement. And when a patient comes to the office, we should repeat the measurement in another day for 2 or more times in different days, okay? And the patient should be calm, comfortably resting for at least 5 minutes. The blood pressure should be measured at least 30 minutes after the smoking, caffeine intake or alcohol ingestion, or at least 1 hour after a meal. Then the arm should be supported at supine or sitting position. The arm should be supported at the level of the heart. And it's better, at least for the first time, the blood pressure to be measured in both arms, in the right arm and in the left arm. And if there is a big difference in the blood pressure in both arms, okay, there may be subclavian artery stenosis. Okay, this patient sometimes needs direct measurement of the blood pressure by intraarterial devices, not from indirect measurement by the sphygmomanometer or automated devices. Okay, but if there is only small difference between the blood pressure in the right arm and the left arm, the higher one usually is regarded as the actual blood pressure for this patient. Okay, then measuring blood pressure in both arms, and it should be repeated within 1 week in different day. And sometimes we use the ambulatory devices. Ambulatory devices measure the blood pressure for 24 hours through a pre-programmed automated device. Okay, through the overnight when the patient in resting, in work, in home, outside. And the measurement of the blood pressure and outside of the clinic have many benefits. For example, identifying white coat hypertension. What's white coat hypertension? Why some people have a normal blood pressure, okay? But when they come to the clinic, they will develop, or the blood pressure will be increased due to nervousness or anxiety to be in a clinical setting, okay? These patients are said to have a white coat hypertension. So how can we define the white coat hypertension? We measure the blood pressure outside the clinic by the ambulatory or home measurement of the blood pressure, intermittent home. If the patient have or available any device, any sphygmomanometer is available for the patient to measure the blood pressure at home, or we give the patient the ambulatory devices with pre-programmed automated device that in regular intervals, for example, every hour or every 30 minutes, automatically measure the blood pressure in this patient, and then all the blood pressure, the average of this blood pressure will be regarded or treated as the actual blood pressure of the patient. Okay, here there's a point, the blood pressure usually in night is reduced. Okay, so this value, which is 140/90, may be lower in the ambulatory measurement for the diagnosis of hypertension. Generally 130/80 or 130/85 or more than 130/85 in ambulatory measurement is regarded as what? As hypertension. Okay, because these ambulatory devices measure blood pressure at the daytime and also at the night time. And during the night time, the blood pressure is lower by about 10 to 20 millimeters of mercury. Generally in night, the blood pressure is lower than 120 over 70. Okay. So, the ambulatory devices can be used to identify patients with white coat hypertension. White coat hypertension, when the blood pressure is normal outside the clinical setting but elevated in the clinic, is not associated with risk factors, cardiovascular risk factors. Okay, and in this patient, drug therapy is not needed. Okay, but there's another term or another condition which is called masked hypertension. In this patient, the blood pressure is normal in the clinic, but it's elevated outside the clinic. Okay, and again, the ambulatory blood pressure monitoring are very, very useful for identifying the patients with masked hypertension. In this patient, there is a risk for the cardiovascular risk or the hypertension complications. Okay, this patient needs drug therapy and managed appropriately, as like the hypertensive patients. So again, to the question, why this value, systolic blood pressure higher than 140 or the diastolic blood pressure higher than 90 millimeters of mercury is regarded as hypertension, and anyone with this value or higher than one diagnosed with hypertension. Studies have shown that beyond this value, when the systolic blood pressure is more than 140 or equal to, when the diastolic blood pressure is equal to or more than 90 meters of mercury, the hypertension complication starts. We have 5 complications to what? The hypertension. Okay. What are the 5 complications to the hypertension? First of all, we have what? We have cardiac complications. Okay. The heart complication. Then we talk about the hypertension complications in detail. But what are the 5 complications to the hypertension? We have cardiac complications. We have vascular complications. Okay. Then we have renal complications. Kidney disease is very, very common, caused by the hypertension. Some patients develop the retinopathy. Okay. And one of the most common complications to the hypertension is what? Is the central nervous system, stroke or either TIA, and also some other complications related to the hypertension and CNS. So the 5 complications to the hypertension is heart disease, vascular disease, including the aorta and major blood vessels, or also other smaller blood vessels, kidney disease, retinopathy, and CNS complications of the hypertension. Blood pressure higher than this value increase the risk of this complication significantly. That's why any patient have the blood pressure higher than this value is regarded as hypertension and should be managed appropriately. And the blood pressure goal, generally speaking, is to be lower than 140 over 90. However, in some conditions it may be lower, such as in diabetes mellitus, when there is more risk of these complications, and also in kidney disease, again, this value should be lower. Then we talk about the goal of the hypertensive therapy in the management of the hypertension. Okay. Now we know the definition of the hypertension, how we can diagnose a hypertensive patient. So we can move to what? Into one form of the classification of the hypertensive patient is according to the blood pressure value. Okay. Here we have classification. Systolic blood pressure and also diastolic blood pressure. Some patients are called prehypertension. What's prehypertension? In prehypertension, they're still not regarded as hypertension, but they are at higher risk than general population to develop hypertension. The systolic value in prehypertension is somewhat between 120 to 139. Of course, all values are in millimeters of mercury, and the diastolic value is between 80 to 89. Because the hypertension is a global problem and it has very common and serious, dangerous complications, even someone who has a blood pressure 120 to 139, which is still less than 140, and 80 to 89 for the diastolic value is regarded as what? As prehypertension. These patients don't need the drug therapy, but they need lifestyle management. Okay, for example, low sodium intake, okay, physical activity, moderation in the alcohol intake, and some other lifestyle modifications, at least to delay the progression into hypertension. Then we have some patients which are called mild hypertension. Okay, or it's called grade 1 hypertension. Hypertension, grade 1. Okay, these are having a mild form of the hypertension. In this patient test, the systolic blood pressure is 140 into what? Into 159. And the diastolic value will be about 90 into 99 millimeters of mercury. These patients are called grade 1 hypertension. Then we have grade 2 hypertension. In these patients, the hypertension is more severe in grade 2, or sometimes called moderate hypertension. These patients have a systolic value of 160 into what? Into 179, and the diastolic value of 100 into 109. Okay, then we have some patients with severe hypertension. In severe hypertension or grade 3, these are severe hypertension. They have a systolic value of what? Of 180, or you can say more or equal to 180, and the diastolic blood pressure equal to or more than 110 millimeters of mercury. These are the classification of the hypertension. And some patients may have a very severe hypertension. For example, when the systolic is more than 220 over the diastolic value of about 130, this patient is generally called hypertensive emergency. Okay, and one form of this hypertensive emergency is called malignant or accelerated hypertension. These are called malignant or accelerated hypertension. What's the malignant hypertension? Of course, it's not caused by the malignancy, but because it's a very, very rapid progressing hypertension. Very rapidly the blood pressure is increased and is associated with rapid complication of the hypertension, especially when there's the retinopathy. Okay, In malignant hypertension, the blood pressure is very, very high. Usually the diastolic value is more than 130 and the systolic is more than 220. And this patient is almost always having hypertensive retinopathy or hypertensive nephropathy. Okay, because the behavior of this hypertension is behaves like a malignancy. It's called malignant hypertension. Okay, this is a very severe form of the hypertension that should be reduced and treated promptly. Okay, this is the classification for the hypertension. Okay, currently, why the hypertension is a major global problem? Let's talk about some data and epidemiology of the hypertension. Currently, more than 1 billion people in this world is affected by hypertension. 1 billion is a very, very large number. For example, just in America, 1/3 of the population, or 45% of adult population, which is equal to about 108 millions, having hypertension. Okay, and out of them, for example, 83 of them are diagnosed. Let's say we have 100 patients. In these 100 patients, 83 of them are diagnosed, while 17 are unaware about it. If you have 100 patients of the hypertensive, for example, this data is from the USA, 83 of them are diagnosed and they know that they have hypertension, while the resting 17%, they have hypertension, but they are unaware about it. Because hypertension is a silent disease, it's asymptomatic in the early stages. Hypertension produces symptoms only when there is hypertensive complications, when there is heart disease, vascular disease, CNS disease, okay, or when there is retinal or the kidney disease. At this time, they know that they have symptoms of the hypertension. Otherwise, mild to moderate hypertension is completely, almost always is asymptomatic. And these 17s may have no symptoms related to the hypertension, so they are unaware that they have hypertension. And from this 83%, or even this is in the USA, in some countries, more than 50% of the patients having hypertension, they are unaware that they have hypertension. And of course, someone not aware about the hypertension, they will not take medications, and without medications, hypertension is a very, very serious problem and progress very rapidly to produce complications of the hypertension. Out of this 83%, okay, hypertension is controlled, or let's say 76 of this taking drugs, okay, they are on the antihypertensive drugs, but 71 of them are not on drugs. They have no effective treatment for the hypertension. These patients may not adhere to the pharmacological agents, or they refuse to take medications, okay? This is more common in men, okay? Even men generally more men refuse to take antihypertensive drugs, okay? Almost always the women takes and adhere to the antihypertensive drugs. And those are unaware of the hypertension. It's more common in men again, okay? Men really don't care about the hypertension. Out of this 76, the hypertension is controlled in about 52 patients, and in the resting 24, the hypertension is not controlled well. So it means this 52 patient is having target or goal blood pressure with the pharmacological treatment, and the resting 24 patient is the blood pressure is not well controlled. Okay, again, in blood pressure is more easily controlled in younger patients. Those without diabetes, hypertension is very difficult to control in the presence of the diabetes mellitus. Okay, usually it needs more than 3 to 4 antihypertensive drugs. And again, the hypertension is more commonly controlled in females when compared to males. Okay, these are some data in the USA. Even in the USA, many children are affected by the hypertension. It's about 11% of the obese children having what? Hypertension, unfortunately. Okay, and this is again a large population. Okay. These are some numbers of the hypertension, just to know why the hypertension is a major global problem. Okay, because many people are affected with the hypertension, and they have a high tendency to develop hypertensive complications. Okay, and many of them are either not aware of the disease or not taking the drugs, or the blood pressure unfortunately is not controlled well to the target blood pressure. Okay,